that what you need, Kevin?
Yes, yes, thank you. Okay. So both of our teams had a few questions with the middle informational item B with the outpatient and office services that require pre-certification. So with advanced imaging, you know, that's currently in place, would that change to where people, if they're needing those imaging services and their doctor's prescribing it, particularly in an emergent situation, that they would be denied and have to pay that out of pocket?
No, that piece is currently in place, and the same rules would apply as they do now. So the ones that are changing are the next three down, which are done right now on a post-claim basis, and those would be added to the pre-claim, like the MRIs and CTs.
Okay, so like with the radiation therapy, if they have cancer and their doctor's prescribing radiation therapy, we're not going to be in a place where they're going to be denied that.
Well, again, it's going to go to medical criteria and the timing of the illness. And what I understand from Blue Cross is there's an online process now where doctors fill this out, answering medical questions. And if the medical questions indicate the criteria meets the definition of that stage of therapy at this point in their treatment, then it would be covered and approved. What they're trying to do is make sure, in some cases, what I understand, there's step therapies to things where you don't immediately go to this drastic treatment. You start here, start there, go to here, then you've been there. So again, it's all going to be medically based and depending upon medical necessity.
So how long would this process take if somebody's needing to start radiation quickly? How long is the Blue Cross Blue Shield vetting and approval process going to take for this radiation therapy management?
Okay, well, there's set criteria for stat versus non-stat, but I apologize, I don't have it with me at the moment.
Okay.
But it's following medical guidelines, in other words, Stephanie. It's not going to be, I don't remember if it's 48 hours. I don't remember if it's 2 to 3 business days. It could be something like that for the stat, and then longer for the other things that are not emergent.
Okay. And how many, it may be through our PowerPoints today. I'd have to go back and look. You know, we had what, 16 of the 60 high claims were cancer.
Mm-hmm.
And so do you know, or could you get that information just so our team knows how many of those are needing radiation, and have they been approved? Like, I guess what I'm trying to get at is we don't want to adversely affect anybody's treatment that's deemed necessary by their doctor.
Well, I would tell you that it would be any treatment that we begin after the January 1st effective date. It would not affect current treatment that had already been started prior to 1/1 of 2022.
Okay. Okay. Okay, thank you for that. So Lisa and our team, just real quick before we move on, did I cover and capture our questions on that?
Yeah, I've got one more and it just doesn't want to come through to the phone. I sent a text for you, so I'm not sure about that one, but
Stephanie,
Okay.
Can I just ask a clarification?
Yes, go ahead.
I just wanted to ask a clarification about the CTs. If in emergency situations, are those still going to be covered?
That's not changing.
Yes, they are. It's not changing. So if it's covered now currently, it would be covered going forward. So the criteria is not changing. We just wanted to do have detail from Blue Cross, and we're searching for that right now. But that criteria is staying the same. The only ones that are coming in new would be the 3 bullets down there. So there'd be no change to what our current practice is since January of 2019. So if it follows medical necessity, it's going to be approved.
So I think that the clearest question is if somebody went to the emergency room and the doctor in the emergency room said we need to do an MRI, that MRI would be done and then covered through our insurance. What I think what the concern was that somebody would have a CT or an MRI and be told after the fact that it wasn't going to be covered.
And again, I don't know of any I can think of right off the top of my head that have been denied, that have been in an ER situation. But the problem is every medical injury is unique, and every medical treatment is unique in an ER setting. I could see CTs being approved. I could see MRIs, but it's going to depend. Do we have a brain bleed? What do we have going on here? The type of injury. But this would not be a change from January 1 of 2019. And all of this, to be honest, is dependent upon the physician answering the questions, as through the process to get these things approved. But so I guess I'm just confused by the question because it's very situational. And the problem is I'm not the physician sitting there saying, what is the criteria for a CT and this should be approved, because each situation is going to be unique.
Okay.
And I can tell you, for the most part, providers are going to want to get whatever authorization they need from the carrier because they don't want to have to try to collect money from a member on a denied claim, because that's a lot of bad debt for the provider in many cases.
Okay. Okay. Hold on just 1 second. I just sent a question in our text. All right, I think we are good with those questions that we had from Part B then. So if you go back up to the deductibles and the pharmacy plan changes, we appreciate you hearing us on the premiums, and we talked back and forth through this, and AFSCME was in our caucus room too, so we jointly talked about this. And so Lisa, you can pipe in, whenever you want or need to. But we are firmly need to be status quo this year. And so we are still rejecting the plan design changes for the deductibles and the prescription drug plan. This impacts our employees pretty severely. And we have employee groups that haven't seen raises in 3 years. They're seeing a raise this year, and we cannot give them a penny to take a quarter. And we have a lot of reimbursements coming, even though they're not here yet. We know that a lot of our health plan will be able to be propped back up with expenses that we're seeing from COVID. Our plan is solvent. We worked really hard. And when I say we, our unions, both unions worked really hard with the district to work together to make this plan solvent, because that was good for everybody. We are in the black. Our trends are looking good. The stuff that can be charged to COVID can be charged to CARES Act. And we know that we're going to see higher things from Delta, but all that's COVID. Both unions feel that we are in a place where we don't have to make these design changes. We could very possibly be in a different situation next year, but I think that history has shown that both of our unions have been willing to have that hard conversation when we see that it is necessary. We don't see that these plan design changes are necessary, and we don't want to give raises in one hand and then take out of people's pockets through the health plan. So that's where we're at. So we are still rejecting these plan design changes, and we are proposing status quo for everything. We are okay with the informational items, but the plan design changes we are not okay with. And Lisa, please feel free to, say anything if I didn't cover everything that you needed to say.
No, I think we pretty much we discussed that, and like I said, we've not even seen any money yet, and to take from that, and we're going to have to pay more stuff like that for our co-pays, and we just can't afford that right now. And our insurance, we have sacrificed over the years for our insurance to get it back in the black and to try to help out. And we do make those decisions when it comes down to it. As Stephanie says, we are willing to, how do I want to word that?
We're willing to have those hard conversations, even with our members who might be mad about the, no raise, health insurance staying status quo. We've had those over the last couple of years, but we are in a place right now where that's not necessary.
Does that conclude the comments? We're going to call a caucus, please.
Okay. All right. So my team, Lisa's team, will go back into the Zoom, okay?